Today's video is specifically for those patients who experience situations like this. When they sustain an injury to their hand, it may or may not result in a visible fracture. However, what they notice is that their fingers fail to move properly. What happens after the injury? Swelling begins to appear. If you feel that the injury is severe, the first and most immediate treatment you can do is keep your hand elevated. Attempt to perform slight movements with your hand and fingers as much as possible. If, even after this, the swelling does not reduce, the next step is to apply ice for 20 minutes. But what if this doesn't bring relief either? In such cases, it's advisable to go for an X-ray. If the X-ray reveals a fracture, immediately visit the nearest hospital for further treatment. The treatment options at the hospital typically include applying a plaster cast. In some cases, the doctor may decide to go for K-wiring, Kirschner wires. The decision whether to proceed with plaster or K-wiring is entirely based on the doctor's evaluation. Now, what happens after the treatment? If plaster is applied or K-wiring is done, complications can sometimes arise in the other fingers that weren't directly injured. K-wires are generally removed after 6 weeks. But what if, even after the wires are removed, you are unable to move your fingers properly? This happens because the tendons in your fingers may become excessively tight or the joints may stiffen significantly. This is where awareness becomes crucial. Many cases are being reported where patients are unaware of the importance of movement therapy for their fingers post-treatment. What should you do? Once the surgery or treatment is completed, apart from the injured area, you should start exercising all the unaffected fingers as well. But remember, do this strictly under your doctor's advice. Regular exercises and therapy can help regain finger movement and avoid further stiffness. Thank you